Welcome to BizRoanoke, and today we are at the Center for Simulation Research and Patient Safety at Carilion Clinic. And we have with us Dr. Sarah Parker, who is the Senior Director at the center. Hi, Sarah.
Hi.
Thank you for being with us today.
Of course, my pleasure.
We love your facility, and I know we were with you last month. This month, we wanted to give our viewers a tour of the facility, and we were hoping that you would be able to help us with that.
Absolutely. It's my pleasure.
Well, thank you. So let the tour begin.
Of course, right this way.
Thank you.
So here we have our mom and baby room. So this can also be kind of a dual patient room. But here we have our brand new, one of our most advanced simulation mannequins. So this is baby Super Tori.
And baby Super Tori's moving all around.
That's right. So she can move, she has reflexes. You'll see with Tori, we can do all different kinds of breathing that are replicating, you know, what happens in a sick infant. She can also do kind of typical issues with little babies. So for example, you know, when they have kind of the issue of with their fontanelles, we can replicate that. She can also do things like jaundice. We can look at capillary refill. So for example, if you kind of squeeze her, you'll see that her skin will go white and then come back. All of these things are really great technological innovations because not only does it help increase the realism for the learners, but it also shows them here's actually physiologically what happens with a baby when you do different kinds of interventions with them. So I mean, she's an amazing piece of technology.
Yeah,
we are really excited to have her part of our suite of tools here. So over here we've got a pregnant mom. So she can do all kinds of great birthing scenarios. So she can do kind of your typical birth. You can see her breathing and blinking and things like that. A little bit of a surprised look on her face, but there you go. Maybe that's how all moms are. So she can do a normal birth. She can also do different maternal emergencies like postpartum hemorrhage or shoulder dystocia, things like that, which again are great for our learners because they are learning on like actual normal yet emergent scenarios. And so we can work on the technical things like how do you actually deliver a baby, but we can also work on some of those non-technical skills like how do you lead this team through a really emergent situation. Up here you'll see on the monitor kind of her standing vitals. We can change those at any time if we need to kind of help facilitate the scenario or to replicate what's actually happening with a patient's physiology in this type of situation. You know, she kind of weighs similar to what a normal patient would weigh. So, you know, if we have to move her, we're replicating that experience as well.
So she can do several kinds of deliveries as a human.
That's exactly right. That's exactly right.
Okay.
So, again,
Very
just
impressive.
an extraordinary piece of technology here. Really, really amazing tool for our learners. And so over here, we have our pediatric mannequin. And so again, he can do kind of all different kinds of simulating different kinds of physiological issues that might happen that are really typical for within a pediatric case. Again, up here we have his vitals here along the wall. You will see this is exactly like a normal hospital head of the bed would look. And so we are also able to replicate, you know, if they have to give him oxygen, kind of how do you engage in that hookup? How do you actually do that kind of work? Throughout the entire simulation center, one of the things we're really excited about is that we have cameras everywhere. So while it might feel a little bit big brothery, it's actually, we're trying to really understand, you know, how are people interacting and allowing them that opportunity to watch themselves and then learn from that experience. So we have cameras throughout this room as well as microphones. So the other thing that we can do is replicate the sounds that occur in a typical kind of two-bed space. Right now, no hospital sounds like this. And so that is something that we're really excited about as well. So really kind of trying to replicate the clinical environment, but give our learners the opportunity to try new things, to learn without the risk to any of our patients.
Okay, now Sarah, this is the patient control room?
That's right.
What happens here?
So this is where we actually can control the mannequins, where we can change their physiology, and this is typically where your facilitator would be sitting. So this is where the person who's kind of teaching or facilitating the course that's happening in the room,
or the teams monitoring the teams.
Exactly.
Okay.
Yeah, that person would sit, and we can do different things, like based on we can notate those videos that we're capturing as the scenario is happening. Again, we can change the physiology of the patient per whatever the learners are doing in the scenario, so it's more realistic. We can also call them. So, let's say they're like, I want labs for X, Y, and Z. Okay. We can call them and say, here's your lab values. Again, to really provide that realistic clinical environment.
Right. Okay. So if I'm maybe a professor sitting in here and I'm observing something, and I see them doing something wrong, I will call them and tell them from this room?
So it would depend on your learning objectives.
Right.
So if you're really interested in kind of immediate learning, you might call over and say, okay guys, let's stop, I'm coming right in. And so they would kind of step away from the scenario, and then you might teach them.
I see.
That's called a deliberate practice model.
Okay.
If you were doing kind of some different learning objectives, you may just take a note of that and say, okay, to minute 3, we need to come back and talk about what exactly happened there. And that is a kind of a little bit more of like an adult learning model, where you are facilitating them kind of in the afterwards, re-watching their performance. So there's lots of different ways to do it. We have the flexibility to kind of manage those different ways. So here we are in our skills lab. So what this room or rooms is for is specific technical skills. So for example, here you can see we have kind of just an arm.
Right.
And what we can facilitate learners doing here is working on things like very technical skills, putting in an IV. So they can try time and time and time again until they get it right, till they feel comfortable with it.
Fantastic. That's
yeah.
I like that.
So there's a lot of different kinds of models that we can use in here. We can use just airway, what we call airway heads. So it's just like a model of kind of from here to here, and practice doing an intubation. We can practice all different kinds of very technical procedures without the high fidelity of that entire room. When you may just need a little bit of practice on this particular skill.
Sarah, so this arm, this is a machine attached to the arm. I guess you all can turn that on, and you may have a scenario where the capillaries are more prominent than if
the
not.
Vein, yep. Mm-hmm.
Yes.
Yep, exactly.
And so the vein is more prominent than not.
Yeah.
So maybe someone lifts weights, you see their veins. Maybe somebody's never worked out and they have no veins.
Yeah. So we can kind of try and simulate some of these different, what you would see in your patient, what would you see, what you would see in normal day-to-day life.
Fantastic.
Yeah. So we are really excited to make sure learners feel comfortable here. So we have lockers for them to store their stuff. We also have charging stations where they can put their phone in, before they go to their next clinical shift.
Right. So this is the operating room.
This is our operating room. We are incredibly excited about this space.
Yeah. Wow.
We tried in the design to replicate the equipment, the lights, the towers, very much, very, very similar to exactly what we have in our ORs at Carilion. So you will see here, we've got a patient on the bed. We can do all different kinds of scenarios here. Right. So we can do things like, simple patient positioning, which is actually really critical, particularly for efficiency, but all, for patient safety, for efficiency of the setup for within the operating room. We can also do different kinds of surgical emergencies. So for those super, super rare things that you are really unlikely to ever experience, but if you experience it, you have to know exactly what to do. So something like an airway fire or something like that, stuff that never happens, but if it does, you want to know immediately how to handle it. So this room, we've also really tried to to make it kind of feel like the OR, so have the same kind of space dimensions. Eventually, we hope that we will also be able to get a Da Vinci robot or something like that in here, as that's kind of where surgery is going. And so we also want to be able to simulate that experience for folks.
Right. Wow. It's very impressive, Sarah.
We're excited. I mean, and again, this is one of those places where yes, we can simulate the technical side of things, but also that non-technical side. So the teamwork, the stress management, the situation awareness of teams that kind of take a good team to a great team. That's the kind of stuff that we really feel like we have tremendous opportunity to work on in this space. What I will show you here is our debrief room. So this is, you know, probably the plainest room from a technological standpoint, but this is the room where we think most of the learning can occur. So I'll just show you really quickly. This is what we call our learning space. So those cameras that we talked about, this is the kind of video that they are capturing. And so I, as a facilitator, so as kind of the teacher during the session, I may have a list of things that I want to make sure my team hits throughout this scenario. So I can very easily, as I'm watching this video, just click on these little buttons and say, oh, yep, they did that, yep, they did that. And the beautiful thing that happens is then it's tagged up here in the video. So when it's tagged, then I, as the debriefer, as the educational kind of facilitator, can just click on that little moment and explore that moment, because I've already designated this as something important that I want to talk about. And so, you know, it really helps. Number one, learners get to watch themselves in action, which is awesome. Number two, it helps you to target your debrief, because, you know, we're not going to remember everything that happened. So it helps you to really think through what are the learning objectives and how am I helping this group of learners hit those learning objectives.
So recall, basically.
Exactly. So partly recall, but also, I mean, we know that human memory is super faulty. And so, you know, I might remember, oh, we got to airway right away. Of course we did, because that's how we do it. And then when we rewatch on the video, actually it took 2 minutes and there was a lot of chat, and you know, you don't realize that when you're in the moment. I'm sure. So, you know, the opportunity to really talk through that as a team and to understand here's how we were thinking and kind of how we got there. That's tremendous from a learning perspective.
And for our viewers, some of these annotations are like clearly communicates the objectives, does not clearly communicate the objectives, creates a safe learning environment, missed opportunity to create a safe learning environment. So those are some of the things that you'll talk about throughout this process.
Yes, and I mean, and the other thing that we can do is have these be technical markers. So for example, this is a trauma scenario up here. So you might say, did they do their airway assessment? Did they check breathing? Did they check circulation, which is normal advanced trauma life support kind of skills? And so did they also get that technical skills part as well as some of the more teamwork oriented stuff?
Sarah, thank you so much for allowing us to be back here today and for the wonderful tour that you've given us. And I know our viewers will be excited to see all the great things going on here. So thank you very much.
Of course. Well, it's our pleasure. And if folks are interested, we would encourage them to visit our website, which you can find if you just Google Carilion Clinic Simulation. It pops right up.
Okay, great. Thank you so much.
Of course. Thank you.
And we'll be right back. Thank you for joining us today, and if you have questions about the segment today, you can give me a call. My name is Lisa Soltis. You can reach me at 540-853-1694 in the Department of Economic Development, or by email at lisa.soltis@roanokeva.gov. Thank you.